All right, it is 6:02, so we are going to get started. Could somebody give me a thumbs up, make sure everything's okay? Okay, thank you so much. My name is Kelly Dill. I am the Director of Advising for the College of Health and Human Performance. Thank you so much for taking time and being here tonight to learn more about the public health and environmental health programs. Um, we'll start out with a short presentation, and from there you'll get the opportunity to speak with. I'm going to have our student worker or our student ambassador introduce herself in just a moment, and then we'll open the floor up to questions as well. So again, like I said, my name is Kelly Dill. I'm an advisor with the College of Health and Human Performance. We also have a couple of other advisors with us today who specifically advise for public health and environmental health, Dr. McNair, Sharon McNair, and Ms. Kelsey Webster. We also have Matt Craven. Ms. Craven is our Director of Outreach, so you might have received emails from her. And then I will let our student worker introduce herself really quickly.
Hi everyone, my name is Simona. I'm an undergraduate junior and my major is public health and I'm on the pre-med track. And I am an ambassador for health and human performance.
Thank you. And so without further ado, I am going to turn it over to Ms. Kelly Russell. She is the program director for the public health undergraduate program. And she is a great resource as well as our advisor. So I will turn it over to her. Thank you.
Thank you and welcome to this session. Just to kind of help me get an idea of how to best spin today's presentation, if you want to drop what your career aspirations are, if you know, and if you don't know, that's okay too. But if you have some ideas of what you would like to do in the long term, feel free to drop those in the chat. I am going to see if I can swap over to a screen share. All right. Can you all see my screen? Thumbs up? Okay, so we're here today to talk real quick about the BS in public health. I will say that public health is very broad, and I'm going to drop this quick little video in the chat at the end of today's presentation. But if I were to ask you what public health was, I think I could probably get a very wide range of answers, from health promotion to research to monitoring to, just like Ms. Dill mentioned, about environmental health. Environmental health is an aspect of public health, but we're all about basically helping other people, and how you choose to help within public health can really depend on what you find most interesting. So the healthiest nation in one generation is one way to look at public health across the lifespan. It's working with everybody, everywhere, every day, individuals that are younger, that are older, different races, different socioeconomic backgrounds, and again, just everybody. So if I were to really ask you what public health was, I think you would all probably venture to say it's COVID. We've seen that within the news the last 3 years, and it's been in front of our faces. But the thing is, there's so much more about public health. And I mentioned you want to help people. Well, you probably want them to be able to say no to tobacco. You want them to be able to practice safer sex. You want them to be able to know what foods to be able to eat to maintain a healthy, balanced diet. So if we're looking at what public health is, it's not what is just within the media, but it is kind of all of these aspects that come together each and every day. If you asked our current students about what they felt about their professors and instructors in the program, we asked them to share in just one word some different descriptives of our faculty. And we have over 40 within our program, so we are a larger program, but you can see some of the ways the individuals were noted within your screen. So we've got our BS Public Health degree, and within that, we have 3 different concentrations. We have our community health, so preparing students for work in community health settings, a lot of nonprofits, governmental agencies, school systems, locations that are going to be working with individuals one-on-one and within group settings. You mentioned Simona being on the pre-med track. So we've got our pre-health professions, which prepares students for some type of advanced professional studies. A lot of times we see more clinical focus right here with OT, PT, PA, other different programs that are going to require some continued studies. And then we also have our worksite track. It is preparing students to work in business, industrial, healthcare, governmental settings. So very similar to community health, but there is more of a business aspect to it. So you would be taking some courses that are related to finance. And we've seen several employers such as Amazon, Verizon, that are engaging with our students and hiring them to help keep their employees healthy. What do position titles look like? Well, you're going to see a few within your screen, but please know that these are not limits. They're just some start points. And we have a wonderful online closed Facebook group where we are daily posting positions. And if I would have asked about different positions, 10 years ago, you would have probably seen a lot around HIV, and we're certainly making strides within that aspect. But today you're even seeing things like opioid counselors, opioid prevention specialists. So again, everything on your screen is a start point, and there are so many different ways that you can help out specific to you and your skill set. Speaking of skills, you're going to see some courses that are listed on your screen. Depending on the concentration that you go forward with, you will have a course path that will help you to get your degree. And you can see some of the courses in that crossover are things such as epidemiology, health disparities, program planning, women's health is a fairly popular course. And over on the other side, you're going to see such as presentation development and oral communication. If you're working with everybody, everywhere, every day, you do need to have those good, strong communication skills. On this screen, you'll see the most easy to understand way to summarize our pre-health concentration. These are usually the paths that are going on to some type of a professional school. So within that, in the little circle more towards the lower right hand, you're going to see a restricted elective area. If you are going on to a professional school, you're going to need some prerequisites to be able to apply to that program. So these restricted elective areas basically allow you to add in courses that will help you meet the requirements of the institution you plan to apply to next. Internships are a requirement for our community health and our worksite health tracks, and it's a cumulative experience that is placed at the end of all coursework, and it is 12 semester hours, and you can see a pretty good sampling of some locations that we have had interns at in the past. We've even had them globally. We've had several students that have been able to go abroad for internships and still get that credit. Now, over in the bottom left, you're going to see it says internship seminar, keep calm and get an internship. We do help you locate internships if you go on that community health or worksite health track. And that public health seminar series is just one additional way to be able to engage. So if you come in and go through our program, yes, you can leave with a wonderful degree. But there's so many other opportunities, such as the public health seminar series, our student organizations, study abroad, and I'll talk about those in just a moment. But there are so many ways that you can become not just a good health educator or public health specialist, but an exceptional one. You can see in the bottom right-hand corner, we have 3 students that were doing their internship that were on our local news. So again, placing you in these situations and giving you skills in addition to what you gather in the classroom. Individuals are able to conduct research. So I mentioned we have over 40 faculty, and they're faculty that are truly the subject matter experts on a variety of public health topics. So individuals can work with our faculty to conduct research, present at national conferences, and share that information, maybe even get a few publications out of it. We have student organizations. You're going to see 2 highlighted. So the left side of the screen is Eta Sigma Gamma. That's our National Health Education Honorary Society. Has a very strong focus on service. So we have several students that go through this each semester. And then on the right side, you're going to see our PEP squad, which is Preconception Educating Pirates. And these students are really focused on making sure that females within the ECU community and beyond are able to make the best lifestyle choices to get to that healthiest nation in one generation that we talked about. Everything a female experiences, is exposed to, does influence those birth outcomes, both today and in the future. I mentioned study abroad, especially if you are an out-of-state student. This is something to look into because it is a set fee, but we have had students go on a variety of study abroads for credit. And this year in May, we have one coming up where we will have students that are learning about public health in England, Italy, and Switzerland. So public health, again, it goes back to everybody, everywhere, every day. And you can see some of the wonderful students we have on our screen. They are learning in classes, they're engaging, they're figuring out the path that they're going to take to make sure that they can make a difference within our field. So I'm going to go ahead and stop sharing my screen. And figure out what questions you might have.
Yeah, and while we're waiting, you can unmute yourself, raise your hand in the chat, or ask a question in the chat. We are monitoring that. So while we're waiting for questions to come in, Simona, do you want to talk a little bit about your experience, why you chose ECU, why you chose public health route to do med school?
Yeah, so I kind of got introduced to ECU. It wasn't really on the top of my list, but I have always been interested in becoming a doctor. My mom's a doctor, and so she kind of showed me kind of what she does on a day-to-day basis, and so I knew that's kind of what I would want to do. So in high school, I actually applied to an early assurance program here at ECU. So I am an early assurance scholar. Which basically means that my spot at Birdie Medical School is saved for me. And this program actually has helped me a lot because it's made me able to kind of explore other sides of public health that I am interested in, like aside from the medical aspect. So a couple of things that I'm doing on campus. I'm an HHP ambassador, which I'm doing with MAG. And I'm also part of an MCH STEP program, which stands for Maternal and Child Health. And this program is a 2-year program where a group of students get together for monthly seminars, and we learn more about maternal and child health in North Carolina. And that is a great way that I've been able to connect with various faculty members at ECU. And it's kind of cool because we also get to go on a conference. So this past September, we went to Boston for a public health association conference. So that was really cool. And it's been 2 years now, so that's a great way that I've made friends. I'm in the honors college also, so that's something that I'm kind of working with. And something cool that I would say that I liked about ECU is that although it is a big school, the faculty really do care about you and will spend the time to get to know you. When I first got to ECU, I didn't really know how to kind of get in contact with faculty members, but I just emailed someone who, Dr. Alice Richmond, who her research sounded interested in me, and right off the bat, she kind of helped me and guided me, just kind of become my mentor. And she's actually helping me right now because we're doing research. But in that way, I've known her since my freshman year, and she didn't ever dismiss me. And I think that can be said for all ECU faculty also.
Yeah.
So yeah.
Simona also just received a Research and Creativity Award, so we're super excited about her for that. Do you want to share what your research project is?
Yeah, so the title is looking at mothers in rural areas of North Carolina. And this kind of was inspired by being a part of the maternal and child health cohort, which again, I didn't really have that plan going into college, but I became interested in that. And I'm looking at finding women who have had babies in the Eastern North Carolina region and kind of interviewing them about their birthing experience, kind of what they wish they knew was different, and what advice they would give to future mothers who are delivering. And I'm planning on creating a little video of their interview, and hopefully we'll be able to share it at a lot of different events.
Thank you. Yeah, it looks like we have quite a mix of interests and type of students on the call. I do see a couple of incoming honors college students, so congratulations there. I also see a transfer student. So if you have any questions about transfer courses, I'm sure Dr. McNair and Ms. Lester can answer that for you. And then Ms. Russell, to your question, it looks like we have a lot of pre-health professions on the call. So we have physical therapy, infectious disease, doctor, pathologist, physician's assistant. And Emma asked the question, what unique programs and activities do you have for someone who wants to go to dental school? I'll let Kelly Russell take that, or Dr. McNair and Ms. Lester, do you want to talk about the Pre-Professional Advising Center?
I'll hop in first, and I was going to say Pre-Professional Advising Center, but I'll let Ms. Webster and Dr. McNair add to that. But I will say, if you're looking at applying to dental school, one of the best things that is going to keep you competitive is a very strong GPA and a whole lot of hours. So volunteering and shadowing, and that's where the Pre-Professional Advising Center comes into play. So if an individual goes on the pre-health track, they are able to meet the requirements of the degree, add in any specific prerequisites that are needed for wherever you choose to apply, Emma, and also allow you that time so it's not science heavy, to where you can take other courses that are still going to help you be competitive, keep your GPA high, and give you a firm foundation in public health.
And Emma, as an academic advisor, we do work in collaboration with the Pre-Professional Advising Center. So you're not going to be left alone to figure out what you need to do for dental school or what you need to do shadowing hours, how many volunteer hours. A lot of what we do as academic advisors is asking you a lot of questions. So be prepared to start thinking about what schools are you interested in going to. Are you going to try to go to a school here in North Carolina, or are we looking at going to a school out of state? The reason we start at the very beginning asking those questions because we want to make sure you're as prepared when you graduate as possible. So that means seeing how many volunteer hours you have, seeing how many shadowing hours you have. So it's not just in the classroom curriculum that you're going to be working with. Paired with the Pre-Professional Advising Center, we're going to go through all of those extracurricular outside of the classroom that's going to help give you a robust resume when you do a project that's in the focus. Does that help you out, Emma? Do you have any follow-up questions from them?
And we are also happy to answer questions outside of academics. Like, what do you want to know about residence halls or food on campus or what the climate is like? So, Simona, what's your favorite place to eat on campus?
On campus, I would say Einstein probably. That is my favorite, like, new addition. Off campus, there's this small Mexican restaurant called Anita's that I really like. So yeah.
Anita's is really good. They've got a good food truck too, so you can find them all around Greenville.
Oh yes, and Miss Russell just mentioned the beautiful weather. I think we have someone from out of state from New York, I think I saw. So yes, it's been in the 80s and 70s last week and this week, which has been lovely. I'm not complaining at all.
You've done study abroad, right?
I'm not in college.
Okay.
Yes.
She's a little world, Simona's a world traveler too, so I always get confused. She her roommate did
The ECU Tuscany program a year ago, and I went and visited her for my spring break. So
Yeah,
that's-
okay, that's what I'm thinking of. So ECU Tuscany is open to honors college students where you spend a semester studying abroad. Yeah, and yeah, for honors college. So
I think
that's
it's
a really,
open to other.
Yeah, I know honors college places a lot of, not weight, but
Yeah.
emphasis on it, I guess is the best way.
Mhm.
So,
And we have different types of study
Oh,
abroad at ECU. So there is like the semester long study abroad. I think Ms. Russell referenced we have faculty led summer study abroads with different programs. So if you're not comfortable going off to a country by yourself for a whole semester, the summer study abroad, you go with a group of ECU students and a faculty member for about 2 or 3 weeks. It depends on the program during the summer, and they're usually themed. And you can go with your major, you can go outside your major. So for example, where are they going this year? I know they've been to Switzerland and London
Switzerland, Italy,
before.
and France.
Okay,
So
Switzerland. and
England is our usual, and I think I said that one earlier.
Yeah.
But this year we're switching it up and going to France.
Yes, awesome. So, and again, you're learning about public health in these countries. When they went to Switzerland, they went to the World Health Organization. So it is a really cool program. If you're out of state, you get in-state tuition. It's 2 classes during the summer. Oh, and we have some questions coming in. So Alana says, would I be able to add a minor for this fall? Yes, and you would work with your advisor on that. So most of the time we can add in different minors. Pre-health students, I think we usually add in the composite natural science minor because it fits pretty well with the prerequisites you're already doing. And you just, again, if you're bringing in a lot of early college courses or you're a transfer student and you want to be able to graduate in a certain amount of time, sometimes it's not possible to do a minor. But if it's something you want to do, we will definitely work with you and your advisor will try to help you figure that out. Micaiah, I'm sorry, I don't know the pronunciation of your name, so I apologize. Where do most transfers or upperclassmen live when attending ECU, on campus or off campus? I think there's really a mix. I would check out if you do want to live on campus. There is a living learning community specifically for transfer students. If you're not familiar with what a living and learning community is, it's a group of students who live together in one residence hall. You usually have a class or 2 together each semester, and you have set social activities that you do together. So I think they live on College Hill in Ballard Hall. So yeah, I think it's either on campus or off campus. It really is a mix. I don't think you could go wrong either way. But if you do want to live on campus, I do recommend checking out that living learning community. And
There's-
Micaiah, oh, sorry, go ahead.
oh,
Sorry.
I was just gonna add, there's also suites specific to like upperclassmen. So as a freshman, you have to live on campus, but then your sophomore year, you could either live in a traditional dorm or a suite type setup. That's also on College Hill.
I stayed on campus the first 2 years. My first year was kind of cut short because of COVID. But the second usually most people I know, they move off campus for their sophomore year, but my roommate was studying abroad, so we didn't want to sign a lease because she wasn't going to be there. But now I live off campus, and I think off campus housing is also an option too. It's very easy to figure that out.
And I'm going to send a follow-up email to everyone who is on here. So if you do have, questions about that living learning community, please just reply and let me know, and I can get you in contact with them. Gabriella asked, does ECU offer online classes in conjunction with in-person courses? I know that the public health major does offer online classes during the summer. We are not an online degree seeking distance education program, so we're not required to offer online courses, public health courses during the school year. So we focus on our face-to-face courses. You probably can mix in a little online courses with some of your general education courses if you would like. I do have students who will maybe, do their public health courses in person, but then have their fine art, like Art 1910 or a theater fine art class online. So, and if you're interested in the online public health courses during the summer, I'll let somebody else speak to that.
So we do offer a majority of our courses in summer in an online format. But I will say most summer classes are going to be in a 5.5, so shortened, abbreviated, fast online learning. With that, especially if you are coming to us as a freshman, getting some of your main courses, and then in summer, you might have an option to pick up a couple of these courses. Totally up to you, depending on how you live. But public health is everybody, everywhere, every day. And it's essential that you go ahead and start to build your community, your network of resources. So having these in-person classes will help not only you, but also those that you're going to be serving. Again, we are an accredited program, so we're adhering to what we say that we're going to do. And for most of our classes, we are in person.
Emma asked, is there a foreign language requirement? And if so, what are the languages offered? Ms. Webster, do you want to take this one?
Yeah, so because the public health degree is a Bachelor in Science, there is not a foreign language requirement. The Bachelor of Arts degrees there is, but that being said, you are more than welcome to take a foreign language if you want to. I mean, I have Spanish, French, German, I want to say Russian and Italian, but not necessarily every semester is offered. There's also American Sign Language classes. Let's see, am I missing any of the foreign languages? But yes, they're not required for this degree, but you are certainly welcome to, take them if you would like. Oh, and Latin, there's a Latin option.
And if you are interested in doing like maybe a minor in foreign language, I know we have like the Hispanic Studies minor. Just know that most of the minors do not start their core courses until you finish levels 1 through 4. And there's placement for that as well. Any other questions? I know you guys have to have something for Simona. All right. Well, thank you guys so much. We will hang out for a little bit in case you want to stay and have any other questions or talk to us one-on-one. But we really do appreciate your time. Does anyone else on the call have anything else to add? Advisors, Simona, Kelly?
It's now coming in, your advisor is going to be doing the best for you to help you through.
Sharon, your mic's messed up.
I think somebody had a question as well.
Yeah, I was gonna ask if you would have access to this recording after, just in case I missed something and I want to like go back and.
Yes, of course. So we will we'll put it on our YouTube channel. We have a YouTube channel which lists all of our majors. So I will send out an email tomorrow that has a link to that as well, along with a few other helpful links too. Thank you for that question. That was a good question.
Ellie, do you have the application deadline information and registration stuff?
Yes, I do. Hold on, let me pull it up.
Okay, thank you.
So for incoming freshmen, I know the honors college deadlines have already passed. But if you're still interested, the deadline for incoming freshmen to apply for fall is going to be April 1st, 2023. That is the final priority application deadline. I will say we are going to start letting incoming freshmen register if you're in the honors college or like a special population like athlete. You'll get to register on April the, let me pull up my calendar, I apologize. I think it's April 6th or April 10th. I'm thinking April 10th in my head. And then, yes, it'll be April the 10th. And then all other students, so all other incoming freshmen, registration for you will open up on April 24th. So be on the lookout for emails from myself, HHP Advising, Ms. Craven, or HHP, because we are going to be, oh, and Emma did ask, hold on, let me get these questions. So we will be available, Mr. Burton, I'll get back to you in just a minute because I have a clarifying question. So with Emma asked how registration works. So you will be getting an email from somebody in HHP or myself to complete a survey. And that survey just helps us to get to know a little bit about yourself, your career goals, and then we will reach out to you with information about registration and who your advisor is. So what we have is there'll be a website called Peer. It's not live yet for next year's class, but it will be soon. And it will have, your first year guide, and it'll kind of list priority classes to register for and what you can fill your schedule with and a how-to registration. So once you get your registration done, your advisor will review your schedule. It's important to fill out that survey because if you have early college credits or transfer credits, we want to work with you sooner so you make sure you're not signing up for duplicate credits. So Jay Burton, the upcoming open house, do you mean Pirates Aboard on March 25th or one of the admitted students Fridays on March 17th? I will say we are available the admitted student Fridays. Okay, so we actually had our admitted student Fridays on February 17th. So it sounds like you'll be, with a different college, but don't let that deter you from going. I'm happy to meet with you, or we'll get you connected with one of our advisors and you can meet with them one-on-one to learn more about public health, or I could see if Miss Russell is free if you would like to sit down with her. I don't want you to feel like you're signed up for the wrong thing, but specifically HHP majors, we did have ours February 17th. But again, we'll be happy to meet with you if you're on campus and we'll make that work. So just be sure to reply to that email that I'm sending in the morning. So Emma, I hope that answered your question about registration. If it doesn't, please let me know with follow-up questions in the chat, or you can unmute yourself. This is probably going to be a question for Simona. What is the best way to choose which residential neighborhood is best?
Yeah, so all freshmen, I believe, are required to live on campus. And if you decide to be in an LLC, like as mentioned earlier, there are certain places that you have to stay. So as I was part of the honors college, and Green Hall is on West End. And so everyone in the honors college lives in that dorm, and you kind of meet other people who are in the honors college. As far as the other living learning communities go, I don't entirely know how that works and like where you stay. And as you get to ECU, you'll talk to upperclassmen and other people who live off campus, and you kind of can get a feel for what you would like, where you would like to live. There are places that are walking distance from campus, and then other places that are a little bit further, but ECU buses do run there. I live at the Bower, which is like a 20-minute walk from campus, so it's really not that bad. But you kind of hear what places are good, what places you would like to live in, what places you wouldn't, and then just as far as like roommates and stuff goes, there's a bunch of different ECU like Facebook groups where girls will post that they're looking for a roommate and kind of a little bit of a bio about themselves, and you can meet people that way. That's how I actually met my freshman year roommate, who's my roommate now. And then you actually for me, I got to know the people who lived on my floor my very first year, so it kind of works like that.
She was a West End girl. I'm a College Hill girl. It's honestly kind of like everything on ECU's campus is relatively close, I would say. And so at the end of the day, you're gonna be where you need to be as far as proximity to classes. So there's College Hill, West End, and Central Campus. Each has their pros, each has their cons. So it's really, at the end of the day, up to you.
Yeah, I was on Central and West End, so yeah, I never lived on College Hill, so I don't know what that's like, but it's close to the stadium, so I think, like they said, it just depends on what you like. Do freshmen get a card for their meal plan, and what are the different meal plan options? So I'll put a link to that, Michaela, in a reply, but I'm also going to let Simona answer that as well if she knows anything about that.
Yeah, so every single ECU student gets one card, and as I was saying, when you're living on campus as a freshman, you do get a meal plan, and the meal plans kind of differ. There's one where you can get unlimited swipes in the dining hall, and then a certain amount of money that you can use for different places on campus to eat, like Starbucks or Cane's or Panda. And depending on what would be best for you, you kind of can vary how many swipes or how much money you get. I know I had unlimited meal swipes in the dining hall, and then I think it was like 350 for a semester, and that was used for if I wanted to get coffee or Cane's at a different restaurant.
So there's unlimited meal swipes for dining hall. Then you have Pirate Bucks, which is like, oh, I'm spending $5 at Starbucks. And then you also have Pirate Meals. So you have a Pirate meal for Chick-fil-A that's, your nuggets, your drink, and your fries. But if you're like, oh, I only eat nuggets, you're going to use your Pirate Bucks. If you can use a whole meal, you use your Pirate Meal. Freshman year, it's pretty easy because you have to have a meal plan. It's kind of that sophomore and beyond. If you don't live on campus, meal plans are optional. And that's kind of where it gets into the weeds of, oh, well, I use more bucks than I do meals or whatever it may be. So freshman year, pretty low key maintenance as far as meal plans, other than just like at the end of a semester, certain things don't necessarily roll over. So it's just important to say, oh, if I have $200 left over, maybe I go to the student store, little like market area and stock up on snacks for next semester or whatever it may be. So.
And I live off campus now, and I don't have a meal plan because I kind of cook everything at home. So.
Yeah, and so then you can still go to places on campus. You can still go to the dining hall and just use a debit card and swipe, and it's like, I think like $8 or something like that. And it's, all these buffet type options, or, I walk over to Chick-fil-A next door and get a meal there. So.
And something else that's really cool that our office just found out about this spring is that the nutrition department does meal pickups during the spring semester, and you can pre-order or you can go by there if you're near the Rivers building, which is near Brewster and where a lot of other gen courses are. They put out the menu every Monday, and it's usually a different thing. So we've done brunch, Thai food, Mexican. This week it's Southern cooking, so I'm really excited about that. So there's a lot of fun things on campus too. Somebody asked if freshmen can have their car on campus. Oh, that's kind of a loaded question. I think so you cannot buy a parking pass for on campus. I don't think if you're a freshman. The freshman parking lot is near the Belk building. But I think there are like third party places where you could buy a parking pass closer to campus. Does anybody know anything about that?
Yeah, so I had a car with me my freshman year. And you just get a parking pass, so you have to pay, but you would have to park your car a little bit further away from where you stay. And I got to park in a closer lot by Sub Dogs, but you can't have it directly on campus.
So there's like tiered levels, and it also kind of depends on where your dorm is. So like College Hill, it does have some parking available to students, but it's also much more expensive than if you lived on Weston and had to go to like a lower lot, almost essentially tiered. And then there's like they call it the D lot parking, which is where Belk is. And there's a bus that goes, and that's probably your cheapest option to get parking on campus as far as like being a freshman and parking your car there. But there's like a bus that goes there. So you park there, hop on the bus, and then head back towards campus or your dorm or wherever you may need to go. So there's a little bit of parking options as far as freshmen on campus. It is a little competitive. So once you register for class, or excuse me, you pay your deposit and commitment to ECU, you've registered for peer, you register for classes. The next step is to make sure you don't have any holds on your account, and then also making sure that you're logging in to buy a parking pass as soon as they're available, because they go fast.
All right, any other questions? All right, well, thank you so much for being here again. Like I said, I'm going to send a follow-up email with some resources and links tomorrow morning. So, ooh, okay, no, okay. So if you do have any questions, please, you can reply directly back to me, and I will get you in contact with an advisor or Miss Russell or even Simona if you have any like other types of those questions. We're here to help, so don't feel like you're bothering us at all. We want you at ECU. We're excited that you're interested in ECU and specifically public health. So please just let us know. So anybody else have anything to add?
Oh, I just put in the chat, the ambassadors have a student run Instagram. So if you guys have any questions about student life or, meal plan, where to live, whatever it may be, you are more than welcome to follow them and reach out. And they will answer any questions. And I accidentally put an extra H in there. So let me resend this.
And that is kind of all of us do weekly takeovers, so you can really see like what we're doing on a day-to-day basis. And that one is run by all of us students, so yeah.
Yeah, who's running it this week? I know Lydia ran it last week and she's always busy, so that was fun.
James is running it this week. So
Okay.
James is another ambassador. He's from the kinesiology department. He's a cheerleader here on campus, like for football and basketball and everything. So he's got a lot of energy and he's really fun to follow. So if he were here right now, his biggest recommendation would be get a bike. Pretty sure he said that in his takeover today already. So he's a big bike on campus guy, which is fun.
And I'll include that Instagram account in the email tomorrow, along with the ECU Health Education and Promotion Departmental Instagrams and Facebook pages. I think we even have no TikTok, but we have Twitter. do we have in LinkedIn? Okay. All right, well, thank you all so much for coming. Again, we'll be hanging out a few more minutes if you need anything. But we will send you this presentation tomorrow, so thank you. I do love the warmer weather, but it makes my allergies. It's okay. Thank you, Siri. All right, thank you guys so much.
Thank you. I just
Now,
realized,
you and Sharon have similar walls with the post-it notes.
oh,
Like a conspiracy theorist, like just trying to connect all the dots.
oh no, Kelly Russell just texted me. It's like, I want to know what your sticky notes are.
Yeah.
I'm
You
like
had me
trying to
curious.
go out. Do what?
You had me curious. I was like, is it a game or what's
No,
going on
it's like the life cycle of an ECU pirate. So instead of us having a different system for incoming freshmen, a different system for when you're a student, a different system for when you are an alumni, ECU is trying to get on one system. It's very, very beginning stages. And so anytime I like think of something that's like, oh, I need this for like prospective students, or I need this for current students, we're
That
like
actually
trying to
makes
build
sense.
it.
One system.
Yeah, you don't say, yeah, but it's in the very beginning process of it. And so like I'd rather have too much information that we're trying to gather while we're building it, so we have everything, rather than on the backside. Like this even has like internship placements, like businesses. So like if we have a bunch of students that go to Heister or Yale or wherever, having that relationship and outlining it that way too. So it's a
This
lot.
being Salesforce.
Yeah, it's for Salesforce.
Okay.
Yeah. So another college already has this like built out, but oh yeah, Sharon, there we go. Another college already has it kind of built out, but ECU is looking at doing it across the board. So
All right. Well, Kelly, if you hear anybody, reach out, send them my way. We'll get them a little
Yeah,
bit easier.
The only thing I can think pressing right now would be I didn't want to tell that person they signed up for the wrong, admitted students day. So maybe just trying to get them connected with you so they can see
That's fine.
some of the labs or something on March 17th. I'll let you know. I'll just kind of reach out and see what they are kind of wanting from that
I'll
day.
be out of the office on the 17th, but I know I could
Okay.
line somebody up. Michelle would do it, or
Yeah.
we would get somebody.
Okay, sounds good. I do. She sent me her email address, so I have it.
Okay.
Yeah.
we were competing with College of Nursing tonight too.
Oh, I didn't realize that.
I just saw it on the TargetX calendar. That's
So
all.
yeah, that probably took away a lot of our. I mean, if you want to do another one a little later in the semester, Kelly, we can. That would be totally up to you. I mean, we can set it up. We've had people do more than one, but we could also wait until. And I also think maybe a lot of people are planning to come in person more, rather than do the virtual things. I'm not 100% sure.
And I haven't heard anything about the plan for summer, but I'm assuming it's, as the past few years, less involved.
Oh, for orientation?
Uh-huh.
Yeah, I think it's the same as
Have you
last
heard
year.
anything?
It's same as last year, is what I've
Same
been
as last
told.
year.
And I have dates, so I can send you dates. I forget you're one of the faculty members. that are
No,
involved,
Charity
but-
tells me to handle it
Oh, okay.
perfectly, so, but,
Okay.
you know, if
Yeah.
anything ever does come up, just keep me in mind.
Okay, yeah, so I won't add you to that, but it's just the exploring majors on day one.
Yep.
And then day 2 in the morning, we just do our little general advising spiel and check their schedules. So they've been wanting, most of the time they have a schedule by the time they come to us, so it's really easy. It's just mostly those exploring majors are mostly for the undecided students and things like that, or like nursing students who need a backup major.
Yep, we'll get them as sophomores.
Mm-hmm.
All right, well, thank y'all.
Thank you.
All right, have a good night.
Bye.
Bye.